everyone. Thanks, Monique. I'm excited to be back on here and actually showering, doing my hair, and talking about something other than trucks and ambulances with me and my 3-year-old. So I'm excited to talk about the neck today because there's a lot of options with the neck, and that's kind of the issue that patients face is they want to know what's the best option for me. And I guess it really depends. So that's where the provider comes in, and that's where the knowledge, and also, like Monique said, the tools that the practice has as well. So what we'll do is we'll go through basically a laundry list of options for the neck. And as you're sitting there and as you've been looking in the mirror the past couple weeks, you can kind of go, oh, I think that's me, or yeah, that's what I was hoping for. And maybe you can start to put together your own treatment plan or what you're thinking about as well. So when I say it depends on a lot of different things. So the main thing is sometimes what I see as a provider isn't exactly what the patient sees. So if I notice, oh gosh, I really noticed that she's got these bands, or she's got some extra fullness here, or she's got some skin sagging, maybe it's a lot of people complain a tech neck that you care about. So the main thing is pick out what you care about first. So make sure that what your concern is matching up with the treatment plan. So when you look at the concerns in the neck, is it skin laxity? Is it too much fat? So you've kind of had that little genetic bulge there. Is it from looking down at your phone all the time? Is it the lines that are bothering you, or the bands? Because each one has a different solution. So what we'll talk about first is let's talk about fat reduction, because I think no one would say, oh gosh, I wish I had a little more fat on my neck. So I'm going to talk about CoolSculpting and also Kybella. So these are both non-invasive procedures that help with increased fat and also skin laxity as well. So if you think about it, if you have too much fat, your skin is going to be coming out further. So just like when you lose weight, the skin kind of comes with it as well. So you're going to get some skin retraction with these treatments. So the two treatments in our office, Kybella and CoolSculpting, again, it's really provider dependent on which one will be best for you. I like CoolSculpt, in my opinion, if you are a true person who has just that small little genetic bulge right there. CoolSculpting is wonderful for it, as long as you can grab it. I also like CoolSculpting for someone who doesn't really have the ability to have some downtime, because it offers very little downtime. And also someone maybe if they have too much bulk, CoolSculpting is a good debulker. So that's kind of where I put CoolSculpting in the realm of fat reduction. So like I said, just small genetic bulge, easy, a debulker, and also someone who doesn't have the ability to have some downtime. Kybella, on the other hand, I love because I am able to tailor the treatment to every patient. CoolSculpting is an applicator, it's an on-off button, whereas Kybella, there's a little more artistry to it, a little more thought to it. So that's kind of where my brain kind of gets going and I get excited about it. Both of these are fat destruction techniques, which means the fat cells are no longer there. Now, if you gain weight, you can still, other fat cells can still get bigger and smaller, but the ones that you have destroyed are gone. So this is a wonderful solution for these issues. Now, Kybella, the reason I say there's some downtime to it is there's swelling involved. But it's actually a good thing, because swelling does tell the body that there's an injury involved, and it brings, I mean, let's talk from a lay perspective here, it brings cells in to help repair that injury. And when that happens, increased collagen production, tighter skin. So you're actually going to be getting more skin tightening from Kybella than you will CoolSculpting because of that swelling. So what I'll tell patients with Kybella, I'll tell them, okay, if you are not swollen tomorrow, please call me. So it's kind of a change in the way we think about things. It's, hey, if you're swollen tomorrow, give me a call, I'll help get it down. This one's the opposite. It really does induce swelling, which is a good healing process to help with skin tightening. So a lot of times I will use that as a skin tightener and not just a debulker. So Kybella and CoolSculpting, both in the office, you come in. I would say they're relatively painless in all of it. I've had both of them. Kybella, I did swell a good amount, But I took it as a good thing and I had a wonderful result. I mean, I ended up with a very sharp jawline, retraction, and very chiseled jawline because of that too. So the results I got from the few days of downtime, I kind of take it as a win. Kybella, when I say downtime, you can do anything you want. So you can pick your kids up, you can go to work. It's not true, I'm in the house and I'm in pain. You feel numb, which is actually a good thing because you can't feel it. But you look, my husband called it like the shallow Hal suit. If you've ever seen that movie where Gwyneth Paltrow puts on the big person suit, so she looks like she's gained about 200 pounds. That's exactly what I looked like from here up. So it's just, it's kind of funny. You could do a lot of memes like this with the double chins, but it is some downtime if you don't want anyone to know what you've done. So that's the difference between Kybella and CoolSculpting. And again, every patient has a different budget. Depending on how many sessions you need, there's a variance in price as well. But the thing I do like about these two is that they are a more permanent solution. So the next thing you got to think of is, all right, so if fat's an issue, you got to treat that first, because there's no reason tightening skin around a big bulge. I mean, it's going to look like tighter skin around a fatter neck. So that is usually my go-to first. And then my thought is, if that solves your problem, great, I'll see you in a couple of years and we could talk skin tightening. But you kind of just go down the list of things that you have and hoping that you don't have to go too far down that list, mostly because of budget too. So I would say Kybella CoolSculpting, number one, see what kind of retraction you get. If it's good enough, it's a win. If not, then we have to go to different solutions like Ultherapy and Thermi. Thermi is a radio frequency. So the difference between these two is Ultherapy uses ultrasound. So same as you would get in an office if you're pregnant, it's an ultrasound, but they focus the beams into a little focal point. So there's all these micro injuries that happen at different depths of the skin, causing tightness in all three depths. So I would say it's a great procedure for someone who doesn't have severe, moderate to severe laxity. And it's actually good for younger patients who are looking to prevent down the line any surgical intervention. So Ultherapy is my, I would say, go-to if you're in your 20s to 30s, 40s, and if you have really good genetics and you're in your 50s, I would say it's an option too. But this is my number one preventative treatment, with a side of, wow, my jaw looks a little bit more defined, my neck looks a little bit tighter, but this is by no means a, I would say, a Band-Aid to a facelift. So this is good for younger patients, and it's good for patients who are wanting to prevent the inevitable. And ThermiRF, so there's different types of radio frequency. There's radio frequency that can be applied on top of the skin, and there's radio frequency that can be applied underneath the skin. We have both, but if I'm saying, okay, Ultherapy's here, let's go to the next step, that's, it's ThermiRF is what it's called, radio frequency. And it's a tiny little probe. It looks like, almost like a thin, I would say, tiny pencil. And it goes underneath the skin, and you're numb, so you can't feel it. I've had no patients complain of pain during the procedure, and it heats tissue underneath. So if you're thinking of efficacy, well, yeah, I mean, you're getting into that tissue. You're not trying to go from the top of the tissue, focus energy, and then land it. I mean, you're there. The other thing with Thermi too is you have the ability to change the temperature, which does a lot of different things. So skin reacts, and collagen and elastin and fat all react different with different temperatures. Fat can be destroyed at a certain temperature. Collagen can be the healing process can be induced at a certain temperature, and that's all up to the provider and the patient's outcome as well. So this is more, like I likened Kybella, this is more of that artistic, technique-driven procedure, rather than Ultherapy is, for the most part, pretty much you go in, this is your procedure, we could tweak it a little bit, but you kind of go, okay, let's see what we do with this. Whereas Thermi is the more provider-based result. So those are your two tightening modalities. Again, younger patients, preventative Ultherapy; older patients, Thermi is kind of where I would go. But there also gets to a point where I look at patients and I look at their goals, and I kind of say, like, how much do you want this tightened? And if they're doing this, or kind of pulling at it, or saying, I want it gone, Well, non-invasive is not the best thing, because if we keep going down this line, you're going to end up in surgical money and a lot more downtime altogether than surgery itself. So a lot of times what I'll do is, before, I'll give them the treatment plan and say, okay, option A, non-invasive, here's what you got. But before you spend that money and before you make that investment, talk with the plastic surgeon. And luckily our consults are free at La Jolla Cosmetic Surgery Center, and we are in the same building as our surgery center. So it's great. Patients, we're on the 3rd floor, they're on the 1st. So patients can walk right downstairs and have a consult with one of the best plastic surgeons in San Diego. So it's a great option for patients to kind of weigh it out, because what they could do is, if surgery is not for them and it's not for everyone, they could say, no, that's great, but let's go with plan A, or vice versa. I've had it go either way. So it's a nice thing to kind of weigh all of your options. So as a patient, you feel informed, and you feel like when you're putting the time, the money, the effort, and the trust into these plans, you know that it's the best one for you, and you don't have to waver on your decision. So that's kind of how it goes with skin tightening. So it's either mild, preventative, moderate, or you're kind of in the surgery zone too. The next option, which is, I wouldn't say relatively new, but more people are learning about it, are these facelift, thread facelifts, people are calling it. And it's a great thing. I mean, it's kind of, you're mimicking when people say, I want to do this, you're using absorbable suture, or I would be a provider is using absorbable sutures to basically hold the skin up. So there's, in these sutures, same suture material if you got stitches, there's these tiny little nicks on them that actually hold the skin up. So it's basically us walking around like this, and it's wonderful, but it's temporary too. So it's one of those things that if you have a, let's say a reunion or a wedding or something you want to look great for, bam, you got it. But they're not going to hold forever. So that's where you want to weigh out surgery and threads as well. So threads are this novel thing where they'll induce some collagen production, but it's not a solution. Whereas Kybella Cool Sculpting, solution, fat's gone. Ultherapy, skin's gonna be tighter and you'll age with it. Threads are kind of like a Band-Aid, I like to call it. They look great, they'll last a couple of years, and in a couple of years, do it again. I mean, these are really designed for, in my opinion, for the people who want that quick fix, and who also want, or don't have the time for the results to come through. So threads are a good option for that as well. And the other thing that a lot of people are talking about too are these Nefertiti lifts with Botox. And it's true. I mean, if you think about it, we have a neck muscle that comes down, and some of you, if you go like that, you can see them as well. That muscle is pulling down, creating skin coming out. So it's actually the muscle that's a little too tight and needs relaxation for that skin to come back as well. So a lot of people I'll see, especially in San Diego, a lot of athletic people or weightlifters that are constantly doing this, or tennis players, those people will have an overactive platysmal band and create that tension between the skin and the muscle. So Botox is perfect for that. And it's, I mean, in my opinion, one of the cheapest and easiest fixes for that. But the downside is you get 3.5, 4 months out of it. So it's a good solution for bands as well, but it also can help define the jawline by, there's a long band, it's called a platysmal muscle. And if you Botox it along the jawline, it kind of relaxes it and allows you to have that jawline again temporarily for the, like I said, 3.5, 4 months. So Botox is a great option too. And a lot of people will say, let's start with that, see where we go, and maybe that'll be the top of our list going down. So Botox is wonderful. The other thing too is filler. So if you're looking, and filler can go in a couple different ways. So there's filler to define the jawline, and there's filler to help with the tiny lines in the neck. Now, both of them are good solutions, but again, I would liken this more towards a thread bucket, because it is a temporary but immediate solution. The only difference is with filler, so everyone is showing these amazing jawlines with filler, and yes, you give me some syringes, I can make a jawline, but it's the amount of syringes needed to create that really sculpted look. Each syringe, I mean, it's hard because as a patient, you don't know what a syringe is, you just know the cost, but it's 1/5 of a teaspoon. So not even a tablespoon. So let's say I had 5 syringes, and that's a lot of money. I mean, you're talking $3,000, $4,000 then. But let's say I have 5 syringes. I only have a teaspoon to work with. And now it's only going to be a half a teaspoon and a half a teaspoon. I mean, how much jawline can I make with a half a teaspoon? So it's just such a small amount. But yes, it can be done. I do it. I would say it's one of the ones that I try and push people away from because I think there's better options financially and for long term. But I think it's an option. I mean, it's an option just like the others. Quick fix. I mean, throw some threads in there, put some filler in there. The only issue is it's a budget issue. So if you have the budget, it's an easy, nice fix for that too. So we've kind of gone down the list of solutions. And like I said, I mean, younger patients are going to need more preventative, little tweaks here and there. Older patients, you really have to look at outcome, desired outcome, and making sure that I'm managing the expectations of my patients and also being respectful financially of what they're going to spend in this journey too. So that's another option to consider too. But Monique, I think what we'll do is if you have any questions or if anyone else has any questions, or I can keep talking, whatever you guys want to do.
Yeah, we do have some questions.
Sure.
So is there a way that you can tell as a patient, I guess, if it's really excess skin or is it fat?
Okay. Yeah. Exactly. The way to tell is, I mean, it sounds odd, but start pinching yourself. So, I mean, this to me feels a little more like skin than this did down here. I mean, now I could feel it. It feels like skin. But when you pinch something or pinch the back of your arm, assuming that you're not very, very thin, but if you pinch that, that's what the feeling of fat is. So it's that skin with a little bit of fat underneath too. When it's just skin, it kind of just feels like skin, like chicken skin kind of rubbing against one another. Then there's no use to do any fat treatments if you've got no fat. And I think a lot of patients will know if it's really skin or really fat. Again, just start kind of pinching around and feeling if there is any at all. And genetically, it usually starts right below here. So that's kind of where you're going to feel it the most. So if you pinch there and you kind of start tapering out and it gets a little bit thinner feeling, then you know that you've got some fat to take care of.
Great. One more question is, do you ever do a combination of these treatments?
Yes, I would say very rarely we're doing one and done unless a patient, like I said, is preventative or they look great already. This is really something that you can't treat one without the other necessarily. And we're going to keep aging. So let's say you address the fat and the fat goes away, but couple of years later, or even same day, let's say you lose weight and the skin's kind of hanging still, then you do a skin tightening treatment. But it really does depend on the age and a lot of genetics too. So I would say the best outcome would be from combining them. It's just more of a financial plan too. Because once you start combining too many, that's when I think, surgery is a better option, or you're going to spend all this money and do all this downtime when you can have a week downtime and look a lot better. So I would say the answer is yes, but very rarely I'll go through every option.
Okay. And speaking of facelifts, so one of our attendees said, I had a facelift about 10 years ago. Which of these treatments might be best for somebody who already had their face and neck done?
Good question. So I would say that's a lot of what I'm seeing too, is patients who have had one facelift, they're not necessarily wanting to get another, but they still care about their neck and their neck is now looking like it needs some help. Again, what I would look at is, let's say the patient, she could have had a facelift when she was 40, so now she's 50. It really depends on age. And the reason I'm saying that is a lot of these procedures really bank on collagen remodeling and production. And the crappy thing is as you get older, you have less collagen to stimulate. So what'll happen is if you're doing Ultherapy, let's say on an older patient versus a younger patient, the amount of cells that you're actually stimulating and the response that you're getting is going to be so much lower. So your result's going to be lower. Oh. So I would say it depends in age. It also depends in tissue quality. So as you get older, your tissue quality decreases. So is it something that we need to build the thickness of the skin? Is it something that, you had a facelift, but let's say you didn't have lipo under the neck. Did you accumulate some fat that we can start with that and kind of tighten up the neck there? So the bad answer is it depends. But what I would say with patients who have had a facelift is it's better to start in 10 years is, and we could treat a neck at any time after a facelift. But what'll happen is patients think that a facelift is one and done or two and done, or I'll just wait to get another one. This is the time that you want to start tightening the neck. So I would say even 2 to 3 years after a facelift, you really want to maintain that investment by these procedures because they're going to work better on you because you have less excess skin after the facelift.
That makes a ton of sense. Um, so another question, Holly is asking, I'm older and I don't have fat on my neck, but I have loose skin. Will Kybella work?
If there's not enough fat, I mean, I'd have to really see. I mean, I'm a smaller person, but Kybella worked wonderful on me. So no one would have looked at me and said, oh yeah, Lauren, you've definitely got a bulge. I mean, I had no visible bulge, but what I received is I received a lot tighter skin and more definition in my jawline because of Kybella and because of that inflammation. So I would say you don't have to be a bigger person to have Kybella. So I would say most people can do it. So I would probably say yes, unless it is truly just skin on bone, then Kybella could help with that too.
Okay. And when you mentioned like combinations, so could somebody do, for example, you mentioned Ultherapy to tighten and kind of stimulate collagen, and threads. Could you do those two together?
Ultherapy and threads?
Mm-hmm.
Yes. So the reason you would do something like that is, I mean, it's if you have an event going on. So let's say you do Ultherapy. The results take a good 2, I would even say 9 months to really see something. So I've had Ultherapy done 2 or 3 times now. And what we were telling patients is 2 months, it is what it is, and then we'll know your result. But what we were seeing bringing patients back, and even with myself, is that patients were looking better 4 months after, 6 months after, 9 months after. So their result kept going. So that's a long time to wait. I mean, if you want to tighten your skin to say, okay, great, do this procedure, I'll see you in 9 months. So threads is the nice thing to say, all right, let's do the Ultherapy. And then after you're done swelling, because there is some degree of swelling with Ultherapy as well, then we can do threads to hold everything up as you're progressing. So it's that kind of meet in the middle where you're taking that 9 months and you want to look good for those 9 months. So there's where the threads come in.
Okay. Now, one of the questions is, which one is the least painful? I love this person. Yeah, aren't we always wondering about that?
Well, I have a feeling who that is. Okay, so let's see. I would say, I mean, least painful, least effective too. So I would have to say Botox. I think Botox out of all of them would definitely be the least painful, but it's also the least effective. So then I would go more on result driven because there's a lot of things that you can do to help with pain. So I wouldn't use pain as a barrier with any of these. I've never, like I said with Thermi, I've never had anyone stop due to pain. And what we do in our office is we have a lot of comfort control. So I'm allowed as a PA to prescribe medication. So what I'll do is if someone has high anxiety, and they're really worried about pain, I can give them medication to calm them down, and I can also give them pain medication. So I would say most of these can be done without them, but if you're a person who says, I really just do not want to be in pain, then we're able to help that as well. And we also have laughing gas in the office too. So there's a lot of things you could do to help with pain. I think your brain should be more results driven than pain driven.
Pain is only temporary, right? Gets us to the result. Okay, another question just came in. Can you do maintenance after doing the original thread procedure?
Yes. So what I'll have patients do is I'll have them do the initial treatment, and there's different threads. The ones that hold up, those are called barb threads. And then there's other threads called smooth threads, and those build collagen. What I'll do is 6 weeks after that, I'll do more of the smooth ones to build more collagen around my lifted skin. And then 6 months after that, we could do it again. It's really, hey, I loved it 8 months ago. Can we lift it a little bit more? And absolutely. There's no limit.
Okay. Um, so another question is, what is your best recommendation when you're trying to define the jawline?
Um, do we have an age on the person?
Doesn't say.
Doesn't say. Okay, so let's see if I'm just saying anyone, what can you do to define your jawline? What I've noticed best, because I'll just use myself, I've done all of these. I've done Botox, I've done filler in my jawline, I've done threads, not in my neck. And I would say the thing that really was the most impactful for me was Kybella. And I think that with a lot of patients too, it really is Kybella, because you're taking away that little buffer that kind of mutes that jawline. So when you go underneath and you sculpt out here, it's almost like fake contouring. You're taking away and creating that shadow, which gives the illusion of a kind of more pronounced jaw, even though you're just shrink wrapping it a little bit. So I would say Kybella was my best result. And what I've seen in patients too is they just look thinner and they have more of that shadowing there. So I would say Kybella, probably followed by, I mean, if you want to fake it till you make it, which, I mean, why not? Filler is another instant one that I was able to see right away after I did filler, where I had that nice contour jawline because I physically brought out and faked more of that bone. So instead of creating a shadow, what I did is I faked more of that bone here. But I mean, it didn't last very long, and I'm a side sleeper, so my right side kind of muted a little more than my left. But I would say for the best thing that you could do, Kybella would be, because it's long term.
And with Kybella, is it a one and done, or is it that you do different sessions?
Kybella is a session-based treatment, but it also depends on the patient. So what I've had patients do is say, you know what, if I'm gonna swell, get it over with. Let's do as much as we can in this session so I can do less of them. And that's how I approached mine too. I just hit it hard. It's like, if I'm gonna look 20 pounds fatter, what's the difference if I look 40 pounds fatter? So I looked big. I mean, I was so swollen to the point where I could go like this and it jiggled a little bit. But I would rather do that than have to do it more times. So I did 3 sessions, same amount each time. And it's really also, I've had patients financially say, I can't spend that much, but here's what I can afford. You got to think of it as it's permanent, it's permanent. So if we do one, and let's just play, there's 100 fat cells, you kill 10 of them, fine. Then the next time you'll kill another 10, another 10, another 10. I mean, those, what are dead, or what are gone. So it's one of those things that you can approach it any way you want. And you got to think of it too, if you're worried about downtime, if you do 1 or 2 a session, they come in vials, that's why I'm calling it 1 or 2. But if you do 1 or 2, you're gonna have less swelling. I did 3. So, I mean, the answer is, of course, it all depends on the patient's goal and what their concerns are with downtime, with financials, or with speed in which you achieve the result.
And Ellie's asking, how long does swelling with Kybella last, and how long to wait in between sessions?
I would wait at least 8 weeks if you can, so 2 months. I noticed I was the most swollen the next day. So day 1, we'll call it, I was pretty swollen, I mean, to the point where I couldn't even put my chin down. Day 2 was still pretty swollen. Day 3, if I didn't say anything to patients, when I walked into a room, they wouldn't really notice anything. I did. I mean, I did. I'm sure my husband did too. But people looking at you who don't look at you every day, they're not going to look at you and go, oh God. So I would say, if you're trying to assume that you want no one to know anything, I would give it at least 5 days. But you could wear cute scarves and do things like that, wear your hair down. But I would say the first 3 days are the worst. There's things that you can do to help alleviate the swelling. I just wouldn't recommend it. Like I said, the more swelling, the more signaling to the body to heal. And I think swelling is a good thing in these type of procedures. So I just let mine go, and I didn't take ibuprofen. I didn't ice it. I didn't wear a wrap. I let it swell as much as it can, which I think contributed to the results that I achieved.
And how long would you say the swelling is for the the ThermiRF, the radio frequency? Or is there a lot of downtime, or is there bruising, or?
There can be bruising. I mean, really, it depends on patients too. Just like with filler or Botox, some people bruise, some people don't. You can bruise one time, you can another. Thermi RF is about, I would say, a little less downtime. You're not going to swell as much, but you will wear a compression on this one. So the swelling does subside a little bit faster than Kybella. So I'd give it about a long weekend.
Okay. That's all the question so far that we have. Is there anybody else who has a question? Go ahead and put it in the chat. And while we're waiting for that, I'm going to share my screen again and put you over here. So if you can see my screen, we're on our website. Can you see that, Lauren?
Yes, I see it.
Okay. Awesome. So couple things I wanted to bring to your attention. So if you wanted to watch any of the past sessions or to see what we have coming up next, you just click up here at the top to events, and that'll show you our upcoming events. And then you go down to past, and I've been uploading them over on YouTube and starting to put them over on Instagram, TV, and on Facebook. So we have links to any of the past sessions. So Lauren mentioned threads, and we have Khan who did a whole session just on threads. So you can come through here and see what's going on in there. And then the other thing I was going to show you is virtual consultations. The biggest thing, as you could tell from Lauren's talk today, is that a lot of it does depend on you and what your goals are, and like she said, your budget. But you know, some of us don't know what we don't know. we think we might want one thing and we really need something different. So the best way for now is to have a virtual consultation. So you can call or text us at 858-452-2066 or email us, and then Charity will get that all set up for you. And if you want to be on our list to know when we are going to be back, because we don't know that yet, but hopefully it will be soon, you can text the word GLAM to 858-452-2066. So that's all for that. And I'm going to unshare and go back to Lauren. Well, we didn't have any more questions come in. So if there's anything else you want to say?
No, I think that the virtual consults are the way to go, just so we can see you and get your idea of your goals. And also, you know, we're able to assess you looking at you. I mean, that's our job. So I think that that's a great option for a more personalized approach.
Great. And our virtual consultations, just I'll mention, is also here on Zoom, but we have a HIPAA compliant version of Zoom so that it's, you know, it's a private session and you don't have to worry about somebody crashing your consultation. So with that, I thank you all for coming. Thanks, Lauren. That was amazing information. And we'll see you all next time. Bye-bye.
Bye.